Hi, it's Julie, the Oncology NP, and tonight we are going to talk about clinical trials. You might be wondering, what do clinical trials even measure? And there are a variety of endpoints that might be what clinical trials are looking for. So the primary endpoint is typically what is most important. And there are a variety of primary endpoints that might be evaluated, but kind of the four most common. First is overall survival, meaning how long did people who took a particular drug in a trial live because of that therapy. The second is progression-free survival, meaning how long was their cancer better before they recurred or the cancer grew. How long was that period of time because of that investigational medication. Next is the objective response rate, and this is the percentage of patients whose cancer got better because of the particular study drug. And then the duration of response. How long did people's cancer respond to the investigational drug? Next up are the secondary endpoints, and these are also very important in a clinical trial, and these are more of kind of just telling us the picture of how patients who were on this therapy worked. How did they do? You have secondary endpoints of safety and tolerability. You definitely want a drug that's not only effective, you need it to be safe. You need it to be tolerable. If it is so difficult to take and nobody's going to take it, it doesn't matter if it's like the best drug in the world. Nobody's going to take it if they can't tolerate it. Next is quality of life, and this is typically measured in surveys, and these can be really honestly long and cumbersome surveys, but they can tell a picture of how are people doing, how's their fatigue, are they able to do the things they need to do and want to do, or is this particular therapy making it really difficult because it's, again, not very tolerable. Next is like a biomarker analysis, and this is looking at, are there certain biomarkers or are there like genetic mutations or changes in the cancer that make it being this treatment, more or less likely to work. And then patient-reported outcomes. Basically, patients saying their experience. How did they tolerate the therapy? What was their experience on the drug? Was it really difficult? Was it really easy? Was it somewhere in between? So when clinical trials are done, they are typically evaluating the standard of care, meaning if you were to go to a prudent oncologist who is practicing how they should and you have this disease, you would be getting the standard of care. So they take the standard of care, what's current